Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. But before we dive into our discussions, let's take a moment to appreciate the tradition of tea time. Originating in England during the 19th century, tea time became a cherished ritual for British society. And speaking of British traditions, our very own Dr. Leah Merle is a British expat who now resides in the USA. She brings with her not only her expertise in mental health, but also a deep appreciation for the therapeutic power of tea time. So grab your favourite cuppa and get ready to sleep yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Welcome to Tea with the Experts. I'm your host, Dr. Leah Merle, and today we're discussing a really critical topic in my mind. It's called workplace trauma. Joining us is Zakia Ovington, a guest whose life journey is nothing short of inspirational. She's an LMHCA in the state of Washington. She's based in Canada, and she's also an EMDR therapist with decades of experience in the corporate world. So Zakia's story began in a quaint mountainous village in India, far from her parents who were pursuing the immigrant dream in the Middle East. And after 5 years of alternating between boarding schools and living with aunts and uncles, she reunited with her family in Saudi Arabia. There, amidst cultural and language barriers, English became their lingua franca. Adapting to this new environment was challenging, but it brought a sense of safety. However, the Gulf War soon plunged them into a war-torn environment, leading to another relocation, this time to the USA. Zakia's always been academically inclined, and she navigated through college and backpacked across Asia, found love, and embarked on a married life where building a career in the corporate world was the priority. She held various roles at Microsoft, GE Digital, Oracle, Salesforce, facing the intense demands of employee and managerial positions. This professional path made her acutely aware of the impact of both minor T traumas, everyday stresses, and then also major T traumas, all life-altering events, as we call them in the field, also on an emotional well-being and health-focused level. Ultimately, Zakia realized that her core values resonated more with healing and support. So this epiphany led her to transition from the corporate sector to her true calling as a counselor. In this role, she integrates her personal experience with professional expertise to assist others, underscoring the importance of understanding and healing from trauma for holistic well-being. Please join me in welcoming our guest, who has turned her diverse life experiences into a mission of helping others to find their path to wellness. Zakia, so good to see you, and thank you so much for being here. How are you today?
Oh, Leah, thank you so much. Thank you so much for having me on your podcast. And what a pleasure. I'm here, and I'm actually really looking forward to talking about this very passionate thing for me called workplace trauma with your audience.
Wonderful, wonderful. Well, let's dive straight in. I do have my first question for you. And really, I'd love us to start, Zakia, by telling us a little bit about your background and actually what drew you to specialize in workplace trauma in the first place.
I've spent 23 years in corporate America. And prior to that, I had done lots of internships, and I've really worked in both small business, medium business, and huge amount of time in corporate America. And I've always been such a very driven person. And in that drive, I've always wanted to be successful and deliver my best. And a lot of my clients and a lot of my peer group also want to give their best. When you're in tech, you're at elite of the elite. So you're always delivering on your 900%. I know that doesn't exist, but we are always thinking this is our place. We belong here. We're going to give our 120%. However, what we don't realize is that environment can be very, very non, might not care back for you as much as you care for it. But the way we are sold on the corporate dream, you feel like you belong with a family. And just like in families, there can be very toxic family environments, unhealthy families, boundaries that are not kept, families that can cause, families that might not be good for the children. Similar to that, corporate environment or work environments can be not good for you. You don't really realize it. So for me, when I went through my journey, I always thought there was something wrong with me because I couldn't meet certain expectations, couldn't meet certain goals. Or even when I did meet certain goals, I always felt like, how am I going to over deliver on my next? That performance pressure was really intense. Part of it, I might have put on myself. Part of it, the company definitely puts on me, on the individual. And so, year 20 into this experience, I began to realize that something is amiss. Like, I was never able to find like a sturdy balance, never felt grounded in that environment. And perhaps it's your late 30s, early 40s, and you're like, oh, I don't know about this, you know? And so I started my journey to understand my pain, my psychological and emotional pain. And the place it started was in the work environment because it was just so, I was putting in 60 to 80 hours a week at work and never felt like accomplished. So that's where my journey began, is to really understand my emotional and psychological pain in the context of work because I never felt grounded or landed.
Beautiful introduction. Thank you for being so authentic and open about your experience. I know that it's been difficult, potentially a difficult journey to get to this point, but you've really had a long career in the corporate world. I mean, you said about 20 years, right? About 20 years, 23 years. So how did those experiences influence the work that you're doing as a therapist, as a counselor?
A lot of my clients that come to me come with trauma. So I specialize in trauma. Workplace trauma is a type of trauma that I specialize in. With workplace, so often clients reach out to me when they go on short-term disability. Something has shifted at work and they feel like they cannot handle it anymore. So then they're on short-term disability and then they come in and go like, I don't know if I want to go back. I don't know how I'm going to survive this. Who am I if I'm not working? Why do I feel this way? What is with my panic attacks? Like, why is it that I can't tolerate what I could have tolerated for the last 10 years? Right? So then I introduce my client through the journey of what they might have suffered in the 10 years, 15 years, 20 years. Some clients will come with something super pertinent, like, I was sexually assaulted at work, right? How do I go back to work? What are my options, right? Again, I don't provide legal advice. However, I do offer them what do they want their options to be, right? To create a language for themselves. Sometimes a client is like, I just need you to give me tools to survive my work, right? Without realizing what is the toxic environment that they're in. So those are some 3 or 4 areas: short-term disability, folks that something big has happened, like an assault or harassment. Sometimes it's just survival. I'm this close to retirement. I can't leave work. Help me just survive this job. And then sometimes it's really deep work. Something might have happened 6 or 7 years ago where they were fired or laid off, and they've never really overcome that dismissal. And they come in to realize, like, am I really that bad? What is wrong with me? So those are some areas.
Wow. And that question of what is wrong with me is pretty prevalent for us as clinicians, I would say. This feeling that people come to us and say, what is wrong with me? Help me, fix me. And it's not what's wrong with us, it's what happened to you, right? I shift that script. It's really important to think about people's experience and their environment and what happened to them that could potentially have been traumatic versus what's wrong with me. We have to shift that.
That's so true. I think that is the biggest work and it's interesting, that shift does not happen overnight because these narratives are so etched into one's essence that the switch to what happened to me is what therapy is all about, and is what therapy is all about. Is that subtle but very important shift in the narrative.
What about for our listeners who might not quite be familiar with the term? How would you define and describe workplace trauma, Zakia?
So I consider workplace trauma as emotional and psychological pain that stems from harmful experiences in one's job environment. At a very high level, that's it. Emotional, psychological pain because of harmful experiences we have had at work. Now, these experiences can include, but not only, bullying, harassment, overwhelming stress, exposure to traumatic events, burnout. And this distress that one has deeply affects their mental and emotional well-being. And it often leads to feelings of anxiety, depression, and even signs and symptoms of PTSD. So it's important to acknowledge that these experiences are valid. Like you said, they're valid and significantly impacting that person's personal life. So that's what I would say is workplace trauma, emotional and psychological pain because of your work environment.
That's a beautiful explanation. So complicated on the inside, but also many people struggle with these things. Many people, this is quite common. I think about the work-life balance term, and I know I've been a part of companies in the past that's not even a thing. It wasn't until I actually got into this therapeutic world and realized what balance actually looks like. And it's different for everybody, but I'm wondering about the common signs that you see, maybe symptoms of workplace trauma that employees and employers should be aware of.
I look at symptoms and signs across a huge umbrella. So when my client comes in, I'm looking at their emotional, psychological, behavioral, cognitive, physical, and relational symptoms. They might present in some areas much stronger than other areas, but you have to kind of keep your eyes open across all these different spaces in their life. Emotional and psychological, this one shows up right up front, which is anxiety and panic attacks. This persistent worry, nervousness, and fear related to work. And especially sudden, intense fear of discomfort. I'll give you an example. And some of this is just unconscious. I remember during my height of my anxiety because of work, I was at a park with my children, and all of a sudden, I started to have heart palpitations, like immense. My heart was skipping, almost like my elevator dropping constantly. And it wouldn't stop. It just wouldn't stop. And I thought I was having a heart attack, right? Yeah. And so really, and it is a panic attack. I was actually having a panic attack at that moment, thinking I need to get on a plane the next day to fly down to Birmingham, Alabama for a presentation. And I was like, I just didn't want to do it, but I wasn't willing to kind of say to myself I didn't want to do it, right? I wanted to just push through. Next one is depression. I do remember times when like life was going great. I mean, amazing husband, kids, car, beautiful house, and all the, accoutrements of a good life. And yet I would spend hours crying. Hours. I have no idea why. Just spent hours crying. I was irritable with my children, with mood swings, hyper vigilant. I would always list like meetings sucked because it was like I was trying to read that room all the time. Was my manager happy? Were my peers happy with my work? What's my next review going to look like? And intrusive thoughts, flashbacks, emotional numbness, because there was just so much emotion. Just turn it off. I don't need to feel any of it. And you know how it goes, Leah. You turn one emotion off, you turn all of them off. Right? From a behavioral perspective, a lot of avoidance, a lot and lot. So you don't want to go into work. You don't want to have that one-on-one with your manager. You don't want to get levels. As in some cases, really decreased performance. You try so hard, but you don't try hard enough from a work perspective, right? Isolation and withdrawal, like that's one. Physical symptoms, loss of appetite. A lot of my clients have IBS, um, physical aches and pains, this weird pain that would just shoot through my back. I'd get sick often, sleep disturbances, couldn't sleep through the night because I'm project managing in my head. And then really difficulty concentrating. The biggest part that I really had a big impact is my decreased empathy. I didn't have empathy for my partner, didn't have empathy for my kids, I didn't have empathy for my colleagues, didn't have empathy for my clients, right? And that constant, loss of interest in social engagement in any part of my life. So it really takes a toll relationally, cognitively, physically, psychologically, and mentally and behaviorally.
It absolutely does. And, you think about that saying, about the Monday morning blues. It's, I know I've been there before. I've been there before where I just felt burned out. I felt dissatisfied, like nothing I did was good enough. And then the high anxiety that you would get, the not being able to sleep. So insomnia for me it was, and then still being awake without good sleep, good REM cycles of sleep by like 3, 4, 5 o'clock in the morning, just nervous about that alarm going off.
Yeah, it's like an iceberg, right? You see a little bit at the top, right? But underneath it, it is deep and vast what the impact of workplace trauma is, really.
I love that analogy of the iceberg. I use an iceberg for a lot of different things, but that's so pertinent. It's really, 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 really pertinent. So you've talked a little bit about the signs and symptoms, and I did want to ask you about the short and long term. But first of all, can you talk about primary causes potentially of workplace trauma? I know it's different for everybody, but are there specific industries or maybe type of work environments where this phenomenon that we're talking about is more prevalent?
Absolutely. So the first, people ask me like, what type of work? I mean, you were in tech. Tech is so stressful. Of course you're going to have workplace trauma. I'm like, now that I've been practicing around workplace trauma for some time, I'm starting to see across all fields, across every job type, whether you are a miner, mining coal, or you are a physician or an EMT, or you're in tech, or you are cleaning house, right? Across all fields of work, there is workplace trauma. And what I sense, the core causes, or some of the core causes of workplace trauma that I have seen is workplace violence, right? When I have a client that was sexually assaulted at work, right? Trauma. Or when you have a colleague, throw something at you violently, assault, right? Harassment and bullying, this is really big. Harassment and bullying happens across all different types of work, right? So persistent, unwanted behavior, whether it's verbal, physical, or emotional, creates a real hostile work environment. And remember, in many cases, people are just trying to make enough money to survive in this world. So they don't really have an option to say, oh, you know what? I'm not going to go into work today. They have to go into that environment again and again and again. And this is the same even with tech or being a physician. You are constantly having put in that hostile work environment over and over again. You have just your agency is taken away. Discrimination. I'm a woman of color, and it is crazy the amount of passive and aggressive work environments where you know, comment jokes about being brown, being black, being indigenous, that really does put a lot of stress in that environment. Again, it's like walking into an office with a lion in it or waiting for someone to just snap at you. Toxic work culture, like work culture that lives off of high levels of stress, lack of support, poor communication, and super unhealthy competition, right? Like a workplace that promotes that where you never feel grounded really can cause a lot of workplace trauma. Overwork and burnout, excessive workloads, no one should be working 80 hours a week. Nobody. Long hours, constant pressure to perform. Like I remember in tech, we would have performance reviews can I curse on this?
Yes, you can.
Every fucking 3 months, Leah. What do you, 3 months is 12 weeks. Now that I'm back in the real world, I am like, that is cruel and cruel punishment. Right? Every 3 months, you're sitting with someone and says, like, what did you do for me lately? Did your performance exceed your last quarter's performance? Right? It's almost like we're being treated like we are the corporation, but we are humans. We're not corporations. Traumatic events, experiencing and witnessing accidents, injuries, deaths in the workplace. You can see this happens a lot with EMTs, firemen, police officers, or even mining accidents, right? Someone falls down a steep ladder and they have immense injury. And then finally, this is so subtle. Well, I would like two more actually. Job insecurity, this persistent fear of losing one's job. This was again big in tech because, every 3 months, performance review. On top of that, tech's just laying off another 10,000 people, right? Finance is just laying out another 15,000 people. Lack of that job security can have an impact on one's well-being. And then more work-life balance, and then unrealistic expectations, the pressure to meet unattainable goals, deadlines, leading to chronic stress and anxiety. So what I'm trying to say is, like, a lot of what is happening in the real world work environment today can cause clients workplace trauma.
So really well said. As you're talking, I'm thinking about all of the different businesses, different worlds that people are a part of, and it covers across the board, really. I'm thinking about my experience in community mental health, right? When there's a system in place and it trickles down and money is the service, right? Money, you're getting paid for the service. I mean, I think about the pressure that's put on individuals in community mental health to serve other people, but to do it a certain way. I remember a conversation that I had with somebody who was above my pay grade, but about how important it was for our clinicians that we were bringing into the company to not have more than 5 or 6 clients a day. Because the level of work that we are doing is so intense, it's so intimate, and it's exhausting, especially if you're doing it right. So I just remember, prioritizing my supervisees and really trying to explain that piece of boundaries regarding, 6, 7 clients a day. That's not okay.
That's burnout. I mean, just thinking 6, 7 clients a day. I mean, that doesn't include the notes. It doesn't include prep. It doesn't. Wow. Yeah. See, systems are sometimes set up to, like you said, to make money and not to support you know, to not to support the people that work there.
You've talked a little bit about how the trauma experience impacts an individual's mental and physical health. But what about more like that in the short term, there's some symptomology there that kind of comes up from a mental health perspective. But what about long-term perspective? What sorts of things do you see regarding impact on one's mental and physical health?
Yeah, well, so long term, long term, think of chronic anxiety and depression. I know in our world, anxiety and depression is thrown around a lot, but there really is the immense impact to your nervous system, to your physiology, to your just neural pathways around chronic anxiety and depression. Situational anxiety, depression, okay, fine, I understand, right? Situational, you know, like for me, if my pet ever passed away, I know situationally I'm going to be depressed for a long time, for a while. Like situational anxiety. Yeah, I need to go deliver a presentation. Great. I need that little bit of anxiety to get myself into shape. Get that. But like chronic anxiety and depression really rewires your entire body. I have been out of tech now for 2.5 years, and I'm finally realizing who I am as a human, like how my body has shifted and changed. I used to be on like 4 different medications. I had thyroid issues, I had anxiety, depression, heart palpitation. So all of this was like reported at 4. And these were chronic conditions. Oh, and I had like IBS, I had, what is it? There's like another, anyway, lots of different conditions. And okay, hear this out, Leah. It's been 2.5 years. I've come out of that tunnel. I have off all my medications. All those chronic conditions have like disappeared. So, diverticulitis. I never thought I would get over it. Like I'm over diverticulitis. And
that is incredible. Wow.
Yeah. So my thing is like chronic anxiety and depression can really devastate your body. So you're not taking the days in front of your life, the ones in the back. So it's when you take days when you're in your 80s and 70s, you're reducing the life expectancy. PTSD is another one. Like I know clients who were laid off just with a notice. And now anytime the quarter comes up, end of quarter comes up in a new job, in a new industry, their anxiety level increases, right? I know clients who have been harassed in one job, switch jobs, and they're just waiting to get harassed again. Their nervous system still is super hypervigilant, right? And those traumatic memories keep flashing back. So PTSD, burnout is real. Burnout can lead to suicidal ideation and suicidality. Right? Substance abuse. Oh my goodness. So many people in my industry self-cope with alcohol, with performance-enhancing drugs, right? Marijuana, Ritalin, right? So I remember this one time calling up a physician and asking him, like, I need to do much better at work. I need you to put me on something. And the physician goes, the only way I can put you on something is if you tell me that you do night shift. So I told him I do night shift. So that is this type of substance abuse that you get into when you're in workplace trauma. Social withdrawal, isolation from friends, family, colleagues. I mean, the very social system that's supposed to empower you is the one that completely drains you at work. So you really socially withdraw. Physical symptoms, cardiovascular problems, like, I've had colleagues do heart surgery to get rid of their heart palpitations. They didn't change their work environment. They've gone through heart surgery.
Wow, Zakia.
Chronic pain, gastrointestinal disorders, like I said, IBS, really weakened immune system. disorders. So long period of time, or long-term effects don't take away your days today. They take away your days in the future. So that's why I'm so passionate about talking about workplace trauma, because it's not, it's not just it's going to be fine. It has long-term impacts.
Huge, significant impacts. And you're talking about short-term, but also those long-term effects as well. You've already shared some personal stories, but are there any more examples potentially from your career where you witnessed and or addressed workplace trauma?
No, I thought maybe I could talk about some challenging cases that came across in my in my work with workplace trauma. And I've kind of pieced this together from multiple stories, so it's not a specific individual story. It's just an amalgamation. I don't know how you say that. Amalgamation of a character and their narrative. Okay. Here's some quotes. If you don't have a good cry in the office at least once a week, then you're not working hard enough. Workplace trauma, right? Imagine having a cry in the office at least once a week. And this was not a female that said it. It was a male. Here's another one. My boss makes me doubt my own reality. He will say one thing one day and completely deny it the next.
Gaslighting. Underline that. Wow.
So, how do you perform at work when you don't even know what your reality is?
Yeah, questioning the employee's reality.
That's right.
That's abusive.
It's so subtle. But it is a form of abuse. Would you tolerate that in your personal relationship? And if you do tolerate that in your personal relationship, I would then ask, where did you learn that was okay? So, but we allow that to happen at work. She's still at work with that boss. I'll come to this in a bit. Every year, at least one person dies because of a heart attack. Some of them are so close to retirement. Right? In this environment, in this work environment, they expect people getting close to retirement never make it to retirement because they will die of a heart attack. The next one is really disturbing. This happens so often. This is one person telling another person, why don't you come sit on my face?
No words.
Right? So how does one deal with that in that environment when they hear that? This is one I've heard often. You're lucky to be part of this team, so act like it.
Be grateful for your job.
Be grateful for your job. So which means that if you see dissonance, you cannot mention it. If you see behavior that's poor, you can't mention it. If you want to raise an issue, you can't do it. Right? You go along with the job. You're there to do the job, but you're also not there to do the job because you have to then. So this mind fuck.
Yeah, that's really well said.
And then for me, I remember I was with a client. When I was in tech, there was a gentleman at work that was very, very powerful. And he was like a kingmaker. Everyone would love to be his mentee. I was like, I don't know about that. Because you had to be pretty. You have to be dressed provocatively for his meetings. And I remember sitting with one of my colleagues and I'm like, are you really going to go to his meeting? You know the type of guy he is. It's like the, the producer's couch in the movie industry.
Yeah, and it's prevalent. It's
in all industries. And I was like, I was looking at my colleague and I'm like, I don't think you should go. Knowing very well, me not going means I am choosing not to be chosen. Right? So that's a mind fuck. So those are some experiences, right? Sometimes it's like on point, something's wrong. And other times it's like a slow burn. Before you know it, you're like boiled in hot water.
I think about the accumulation of that type of trauma and what it does to individuals, and it spreads out into their personal life, right? The professional becomes personal because it's hard to have boundaries in an environment like that. When you're working 60, 70, 80 hours a week, just fill in the zero, right? You know, it's so hard to be able to implement boundaries, but also the effects are physical, psychological. It's the effects are significant. Yeah. Wow. Thank you for sharing some of your personal experience. It's so terrible to listen to, but also I think it's just so important for people to hear actually what happens. So in some ways we can normalize people's experience and that they can get support.
Yeah, I'm very open with what I went through because when I went through it, I thought something was wrong with me, right? What is wrong with Zakia? Like, why can't she just go with the program? Why does she always have to say no or ask questions like this or feel like, oh, this is not right? Is something, why is everyone else okay with it? And I'm not okay with it. And then now I come out and having done so much training in trauma work, I realize it was a very abusive relation. It's an abusive, toxic environment. And it takes, you know how it is with abused women and men that have been in physically intimate partner violence. It takes about 35 attempts before they actually leave. Similarly, it is the same in this type of workplace environment. It takes many, many, many attempts before you finally realize, okay, I'm done.
Yeah, and then I think, you know, you'd spoken a little bit about like people's worlds and livelihood. It's the paycheck, but it's not just the paycheck. Specifically in the United States of America, it's usually the health insurance for their entire family, right? How do you survive without one, a paycheck, especially within society with such inflation that we're managing, but health insurance being taken away as well? I mean, there are so many concerns and worries, like how do we live our lives, right? With
in addition to health insurance, it's also the way of life. Like you live in a particular neighborhood because that income facilitates that. If you leave, then you will have to move, pull your kids from school. Like there's immense, I call it the golden handcuffs. I mean, in the industry, we call it like the golden handcuffs keep you prisoner to this type of abuse. And you're right, Leah, it's the systems that are set up in our society that does not protect the individual, it protects the corporations.
We could probably talk a lot about that, but that's probably another conversation.
Totally. This is heavy stuff, Leah, you know? People think we tolerate it because we think it's private and it happens to us because we can't handle it, but this is happening I think this is happening as a chronic level. What is it when there's like a COVID was a plague?
Oh, an epidemic.
It's an epidemic. Thank you. I do believe this is an epidemic that we don't really talk about. Me Too movement scratched the surface on sexual misbehavior. However, there are so many other levels of misbehavior that is happening because of our corporate environments and work environments.
Well, thank you for being here to talk about it today. Such an important conversation. I'm wondering about, I mean, you've talked across the board about difficult scenarios, but what were some of your most challenging cases that you've encountered? Maybe as a clinician, but also maybe out in the field in the organization. Like, how did you experience that? And how did you support? If it was a client, how did you support your client?
There are multiple ways to support a client at work, right? In the work environment, as well as in therapy, right? When a client first comes to me, I never ask the client, oh, tell me about what happened to you. It's really hard. It's very difficult for a client to relive what happened to them. And they can't make sense of what happened to them. Often they just minimize what happened, and they usually come in because I'm like, give me coping skills. I love that one. Give me coping skills. So I will say I'm a very trauma-focused therapist. I have immense training on structural disassociation, on EMDR, on ego state therapy. And I come from a place of what has happened to this person's psyche that allows them to suffer without saying I should not suffer. What part of them is holding the suffering? Because the going on with life part, right? I give that to Janina Fisher and her idea of going on with life part. Going on with life part is doing the job But then all the other dissociative part, the part that submits to this type of behavior, the part that's frozen in time, the part that's angry, the part that wants to run away, like really begin to understand these parts. So do a lot of that, teach the client that what they are experiencing is just that tip of that iceberg. There's so much more underneath. So trauma-focused therapy followed by really giving them a lot of resources to find their grounding. And then I do the EMDR work where we go back to really early on, whatever the negative cognition that might be, like, I'm not good enough. They didn't learn that at work. They learned that way long before.
Early years.
Early years. So we go back and we sensitize some of that, give them lots of coping skills. Now, I'm also support the client with medication too, right? Sometimes talk therapy we need like a cast while the hand is broken, and the cast can be antidepressants, maybe even sleep aids. So I asked them to go talk to their primary care physician who will do that work. I do intense therapy, so I'm never looking to see a client for just like, oh, I'm coming in for one day a month. And no, we do intense weekly work until you feel better and you will have good grounded footing. In addition, we do a lot of stress management techniques, do like mindfulness and meditation. I've had a client go take kickboxing classes because they're in such freeze and submit state. They need to get a little angry, right? They haven't experienced anger in such a long time. And then I also have them work with their work, right? Work has a lot of support options too. Like employee assistance programs offers them discounted counseling, right? Sometimes we do. I remember at Salesforce, they had therapists that are in-house that can help them manage any interpersonal issues that they might have. And then, of course, safe reporting mechanisms, right? If there's any type of assault, violence, verbal, whatever it might be, that needs to be reported. So sometimes that can be a cathartic experience for the client to actually go into HR and put a report in for what has happened. I will say, though, I have got a mixed belief on HR. HR is the company's advocate. They're not yours to get your own advocate, right? It is a therapist. And if there is assault or violence, then you need to get a lawyer and you need to have a proper conversation with a lawyer. I also tell my clients, document. From the moment it happens, document everything. Because if it does escalate, you've got that documentation. A great way of doing that is sending yourself an email. Support groups. There's actually tons of support groups around this. Mentorship programs, peer groups. And then take some training. I tell employers especially, really have your managers take training in trauma and mental health. And in some cases, really implement policy changes, right? From a self-care strategy, clients are all about, like you mentioned, Leah, establishing boundaries, healthy lifestyle choices. But you need to learn how to do that because you haven't done it for such a long time. So those are not immediate things. Those are more long-term. Anyway, I'm going on and on and on, but there's just so much that you can do. But when you're in that moment of immense stress, you don't think about all those things. And that's why working with a professional who understands workplace trauma is very helpful.
No, this is super helpful for folks that might be listening they're in this circumstance. It covers, especially our westernized society that we work in, the United States of America specifically. It's really, really prevalent. And I know you mentioned EMDR therapy, which I know about, but I'm not sure about the listeners. So can you talk a little bit about EMDR and how it helps individuals dealing with workplace trauma? And then maybe you talked about, trauma-focused approaches. Are there any other approaches that you find effective in treating this type of trauma?
So I think of EMDR therapy as a water bottle, When you are young and something traumatic happens, it fills up a little bit of that water bottle. But you have so much more space to kind of like manage your life. And then as life goes on, you fill up more. So maybe somewhere along the way, when you're 3 years old, your mom said, "Oh my goodness, Johnny, you're not good enough to be a soccer player." And so in your head, you go like, "Oh, I'm not good enough." And then you have a first heartbreak and the girl goes, "You're not good enough for me, Johnny." Right? And then your first job, you get laid off. "I'm not good enough. I'm not good enough." Next thing you know, this "I'm not good enough" water bottle container is pretty full. So then you show up at your, third performance review out of the year. And then the boss goes like, "You're not good enough right now." And all of a sudden, all this gets activated. The water bottle comes flowing and you have no more capacity to handle it. So I think of EMDR therapy in two ways. One, we go back to that original understanding, the original statement that your mother made, "You're not good enough," and really like put it in the right place. Because it's nothing to do with you are not good enough. It's like you're a kid. Kids are not supposed to be good enough. That was your mother's head trap.
Yeah. Yeah.
So then we kind of file this all properly and then empty some of this water bottle so that you have room now. So when that performance review does not go well, right, you can be more like, "Oh, unfortunate. It has nothing to do with me." And if it does have something to do with me, then okay, I'll figure it out. Maybe you have this immense sense of you are not you are not broken, right? Maybe the systems might be broken, or I don't know, it was just a bad quarter. You don't punish yourself so badly. So that's what I love about EMDR therapy is it clears your neural pathways so you don't really believe that you're not good enough.
I love that explanation. I'm going to use that one. Thank you, Zakia.
Well, you're welcome. I give that credit to Sujan, who was my basic training professor. She did a good job.
I always encourage supervisees to take EMDR training because I think that it really is such a phenomenal evidence-based treatment to treat acute trauma and crisis in particular.
Even if you don't practice trauma work, even if you don't as a clinical counselor, you learn about trauma. Trauma, again, is like the tip of the iceberg. You just see the mountain.
I think I want to ask about the organizational perspective at this point. What, as an employer, I've been a supervisor, I was a C-suite executive for a period of time, been a manager, a leader. What steps can employers take to prevent workplace trauma, or supervisors, managers? What can we do? We've talked about the systemic issue, but everybody has a small part to play, and what can they do differently?
I've been thinking a lot about this question, Leah, and I'm kind of divided. So managers play two roles, right? They're managers and they're also human. Humans come with their own water bottle. So you have a manager that comes with his or her own water bottle. And then you have the system, right? They have to kind of balance them both. So from an organizational perspective, really training managers in effective leadership and communication. Really equip the manager to understand that they have their own water bottle, right? Their own narratives, their own stories, what are their own triggers. Like, it would be amazing if managers are not just given performance coaches to coach the manager, but also like mental health professionals to kind of process their own emotions that they bring to their work. So it really to equip managers with skills to lead with empathy, provide constructive feedback, and to support teams. Middle managers have it the worst because they have to care about the people below, but they have to answer to the people above. So really, those middle managers are the ones that really need the support. Because I have experienced middle managers that just was, I remember being a middle manager, just overwhelmed, Leah. Because I see the 7 people that reported to me and I know how fragile they were and how hard I had to push them. Like I knew, like I couldn't be empathetic. There was like empathy is taken away from you because you get so much pressure from above to have them perform and deliver against commitments, you know? So really like train your managers, but also support your middle manager, like train and support your middle managers. Encourage like regular check-ins and supportive conversations. I have this one organization that I love. They had kind of like a wellness, uh, like a wellness leader, but their job was not to just create yoga classes. They would grow into group environments and do critical risk assessments. Right. So if there was enough complaints from within a particular group that something is wrong, right? A lot of people are like putting in complaints into HR. This risk assessment person will come in and assess like what is going on. What type of treatment does this organization need? Um, like who is the identified patient?
Yes.
Right. And I thought that was really powerful. I don't know if it's possible to do it at a larger scale, but can you just imagine if that type of supportive environment allowed for really important and difficult conversations? And an assessor that is not a human resource person, like a third party assessor.
An external source. I love that.
So really for them to conduct those risk assessment, and then to really like promote physical safety and security. Talk about lots of places where that is forgone for like, oh, it's going to be fine, but it isn't. People have lots of mental health issues. Like imagine working in a closed off mind environment and you're a female. Make sure there's the environment itself is safe and secure, not only from falling objects, but also from other interpersonal violence. Yeah, so those are some, those are some things that can always do, like reporting those issues, documenting incidents. But from an organizational level, I would be a big fan of a third party risk assessor coming in to be like, what's wrong with this organization, this group, and what can we do to fix it?
Wow. And that brings me to, we talked a little bit about the leadership and the middle management, but how can employees advocate for their mental health in potentially traumatic work environments?
First, I would say, yeah, everything is in a continuum. Sometimes your water bottle is just this full and you can handle it all. So if you are here and you can handle it all, then perhaps you set boundaries, right? You set boundaries to clearly define and communicate your limits regarding work hours, workload, availability. Ensure that you take breaks. Make sure you take your vacation times, but you set those boundaries and you hold firm to them. But sometimes you are like up here, right? Here you need professional support. You can't do this on your own. You are in full fight or flight, submit. You're in a state of neural distress. Consider seeing a therapist or a counselor. Utilize your employee assistance programs, and really go with confidential counseling and support. Specifically, maybe working with someone in workplace trauma, where you're not educating the therapist on what workplace trauma is. Sometimes you're right here in the middle, right? And if this is the case, find allies in your organization, find support groups, seek a mentor, find mentors that have gone through this, that have gone through the path you have gone through. So identify the mentor, seek their guidance. Maybe they can help navigate challenges and advocate. Maybe they know something about this manager you're working with, a hidden secret that everyone's talking about, but no one's talking about. Maybe they know something about a new job that you can go to that would be great. So get peer support groups. And then I know this is really hard. Maybe if you're here or here, advocate for change. Propose changes in the workplace with your HR, with your skip levels. So it really depends on where in the water bottle you are. And so I would never tell someone who's coming to me up here, like the first time I see them, up top of the water bottle, oh, you need to set boundaries. Like, I wouldn't, because they wouldn't even know where to begin. I will say the last thing is there are times you need to seek legal support, right? Know your rights. Familiarize yourself with your legal rights regarding workplace safety and mental health. Like, right? Understand the protections really provided to you by labor laws and anti-discrimination status. So one of the things I did after going through all that is I did call an anti-discrimination lawyer, and I had a free consult with them. And I asked them, is there anything that I can do there? And they were very like, here, this is what you need to do. So know your rights and know when to call for help, whether it's counseling help or whether it's legal support. Oh, I'll say one other thing is that in many scenarios, the government does have crime victims assistance programs. So say something does happen at work, I know Washington State has it and British Columbia has it, where the government of Washington State and BC provide resources and funding so that you can go to treatment. So because you were in a crime. So the crime might be a sexual assault. It could just be an assault of any sort. It could be theft, whatever it might be. There are programs. They're called CVAP in BC. I forget what they're called in Washington State. But again, know those type of resources. And this is why talking to a workplace trauma therapist is helpful, because we kind of understand these rules.
I, as a private practice clinician, I do provide my services for an employee assistance program. I won't say the name of it, but it's a really great model that supports a lot of these tech companies that you're talking about. And I really enjoy working with them because they make therapy accessible. They make it really accessible for people, because therapy sometimes, we're talking about destigmatizing mental health, but it's about ways and means. It's not always easy to gain access. People have got waiting lists. It's expensive. Who can afford it? So EAPs, I really believe, do help kind of give access to therapeutic services when people need it.
So yeah, I'm with you. Yeah, absolutely take advantage of your EAPs.
What about strategies to build resilience to recover from workplace trauma? When you've talked a little bit about treatment, but can you go in a little bit deeper regarding strategies that individuals can use to build resilience from their experiences?
Yeah. Well, resilience is an interesting word, Leah. I feel like you have to come out of the tunnel a little bit. You kind of have to go through it. You don't stop. Just keep walking through it. Resilience comes from all the things you do to empower your own needs. Like, you have to go through the journey. You cannot have resilience before you go through this journey.
That's so true.
Because I hear this in corporate environments all the time. You have to be resilient. You have to be resilient. And there's so many books written about corporate resilience. I feel like what it's saying is shit's going to happen. You just have to keep your chin up and swim through shit and be okay swimming through shit. I'm sorry.
I love it. That's a beautiful way to talk about it.
Right? Like, that it is. But for me, resilience is like, you need to realize you barely have your head above the water. It's not water, it's shit. And firm ground is where you really belong. You're not a dolphin. Do you know? Like that, once you go through that self-awareness, and that's the journey through the tunnel, right? Sometimes clients are not ready for that. And they have to be ready. And at which point I am very transparent, like, baby girl, you're not ready for that. What you're wanting to do is, it's shit. You just have your little nose holes above the water. Like, that's what you are wanting, is for me to give you these tiny little pump up arm vests that can pop you up a little. And I sometimes tell my clients, I can't do that for you. That's, for me, it feels like the wrong thing to do. like, so when clients work with me, I'm very like open. And if they are not willing to do the work of, I'll give you the tools to pop you up, but you need to do the deep work on how you got there. So for me, resilience is that horrible journey of going through that tunnel, self-awareness, not acceptance, but, self, trust and commitment, living by your values and all of that. You kind of have to build all of that. And then they come out and they're like, oh, now that was resilience.
That's right. Look what I did. It makes total sense to me. Look at the journey. It's about the journey too, right? And we talk to clients about this, whether it's workplace trauma or not, but you have to be ready. You have to be ready to make the change, right? And in kind of apply those things that you're learning in the therapeutic process. But also you mentioned something about like people minimizing others' experience. That happens all of the time in experience. Oh, you don't feel like that. Oh, really? You're dramatic. Oh, that's not really. It's not shit. Of course it's not shit that you're swimming through. You're just being, it smells a bit, but you're just being so dramatic.
So dramatic. Like, I've been told that. I actually was once told, oh, Zakia, you're so high needs. You walk around like a peacock. And I am like, what does that mean? A. And then B, I was like, there's so many things wrong with what you just said. And this was a skip level manager, So people will minimize or make you feel like you are somehow like too much. You're too much for us.
Especially if you're a truth teller. I talk about this with my close circle all the time. People don't like truth tellers. People don't like people who speak their truth because they can't always handle opposing opinions, right? I mean, we see this in the political landscape all of the time, so it's just so hard. It's so hard in that moment.
It is. And I think one of the reasons why I love this profession is I get to tell the truth to myself. I don't, we teach others to notice truth. So we have to notice truth too. And without minimizing it or without making ourselves believe that we are overblowing it. Like we get to observe truth, which is pretty powerful.
I feel so grateful for being in this field, but that just nailed it for me right there. Yeah, we get to kind of experience truth. That's just so beautiful. Yeah. What about workplaces providing ongoing support and resources for employees dealing with trauma? I mean, I know we have like the disability process, and then we have, EAPs. Are there any other type of ideas or thoughts that you have for workplaces providing ongoing support and resources?
It's like I mentioned, Salesforce had like a group of specialized therapists that were working in-house that could provide therapy. I also think you have to be careful who, mostly short-term disability is an insurance model. Insurance companies don't want to pay out. So you have to be really careful how you engage with the short-term disability organization within your company. A lot of my clients make the mistake of, when we are so vulnerable and we are hurt and we are in pain, we'll reach out to people for help. And sometimes in that process, we might reach out to like the short-term disability team or, in BC, it's like WorkSafe. But they're not set up to help you heal. They're set up to make the most money. And they do not want to pay out. So what I'm trying to say is like, there are like short-term disability programs where you can take 2 months, 3 months off to heal. They will provide funding to go to therapy, massage, etc. But sometimes they will not pay you out because somewhere in the therapist's notes, the therapist made a comment and they're like, well, no, that's not really therapy for this particular anxiety. This is for some other anxiety. So in the circuitous way is like there are other resources, but really be mindful. Talk to your HR. And everyone should have access to their employee guide book go through your employee guidebook, go online, look at the employee guidebook online on what resources are available. I think we covered a lot already, Leah.
Yeah, I think so too. I have to ask about any other new treatments. We talked a lot about, trauma-focused work and EMDR, but are there any new promising treatments or approaches on the horizon that maybe you're excited about?
I am really excited about EMDR. I really am. And I've actually started to use it a lot more for workplace trauma, really, like, as well as TIST, which is a Janina Fisher model. And and then I do like ego state therapy with Robin Shapiro's work. I would say structural disassociation is the thing that I love. And bringing structural disassociation to my clients, helping them understand that they can have the two different emotions about the same thing. They can love work and hate work at the same time. And it's not the part that loves work goes on with life, and the part that hates work might be the part that feels abused at work. So I would say that. I would say a lot of therapists use CBT and DBT. And there's time and place for CBT and DBT, right? If all you're doing your treatment for, if your treatment for workplace trauma is trauma-informed CBT, I would question that, because I do think, you can't think your way out of a deep neural tension, distress. So really, I personally like integrative approach where you pull from attachment, attachment therapy, you pull from, structural disassociation, you pull from EMDR, you pull from hypnosis, and you craft a solution that's relevant for the client.
That's a true integrative approach.
Yeah, that's right.
You're speaking my love language now, Zakia. This is my geek mind of theory goes ballistic.
I know, Leah, I love
talking about
mind. We geek mind together, Leah.
we geek out together about theory. It's really funny. I love that. It is, and it's one thing that you said that I think is really important is it's about the client. It's not about us as the clinician. I truly believe this as a clinician. It's about what the client needs, and it's about what they're bringing to the table. And that's how I really feel about an integrative approach is you can meet the client where they're at by really kind of treating their needs, So I think that's really, really important. Well, you know what? I think we've come to the end of our time together today, Zakia. I've thoroughly enjoyed this conversation. And I'm so, so grateful that you've decided to join us. And really, thank you for sharing your insights and your expertise with us today. And before we wrap, I guess my last question, my final question, do you have any final thoughts or advice for our listeners who might be struggling with this phenomenon that we're talking about today, workplace trauma?
I want to end with what workplace trauma is again. I think people don't... I want them to realize it's not all on their head. Okay, so workplace trauma is the emotional and psychological pain that stems from harmful experiences in one's job environment. That's super simple. If you can launch yourself from that definition, you are able to not feel gaslit for your emotions. Right? Find a safe place where you can actually talk through it. Whether it is a peer support group, whether it's therapists, whether it is your primary care physician, find a place to start talking about those harmful experiences that you've had and the pain that you are suffering from.
That is a beautiful ending. Thank you, thank you, thank you. I'm so grateful for you joining us today, Zakia.
Yeah, it was a pleasure, Leah. Thank you for creating this amazing space where you bring awesome topics to talk about.
This is a passion project for me. There's no doubt about it. And, we talked about it before regarding destigmatizing mental health issues and getting help and support. And so this is my small way of being able to help. So thank you for joining us. And thank you, listeners, for joining us on this enlightening episode of Tea with the Experts. Please remember to subscribe and tune in for more conversations that aim to destigmatize mental health and foster a more compassionate world. Until next time on the What Is series, please take care of yourselves and each other. Bye for now.
Take care.